And for more on this, we're joined on the news at 10 by the Director General of the Nigeria Center for Disease Control, NCDC, Dr. Ifedayo Adetifa. He joins us virtually on the news at 10. Thank you for joining us, Dr. Adetifa.
Thank you for having me.
You know, one would naturally expect that we will get better at handling this, but it looks like we're regressing. Is there a simple answer as to why, instead of getting better at handling diphtheria, we seem to be regressing, judging by the number of deaths from this outbreak?
Thank you very much. I'm not sure I agree with you that we're regressing. The history of this outbreak is that the first few cases were reported in December last year, and a response was mounted both in terms of case management, surveillance, and even reactive vaccination. And we had an initial decline in the number of cases. What we then witnessed was a sort of a second wave from about June, with more states now reporting cases compared to the numbers that we are reporting before, and the numbers did go up. But also, we now have had a couple of weeks of an effective response. And what we are seeing in terms of the trend over the last now 3 to 4 weeks is a decline, a gradual decline in number of cases. We are keeping an eye on that, also to make sure that we investigate what is happening in silent local governments. That's places that are proximal to locations that have cases but are not reporting cases themselves. In addition, we still have rapid response teams out now in about 8 states, still supporting the response. And we are hoping that this, along with previous outbreak efforts at state level, vaccinations that have been going on, will lead to a steady or maintain the decline in the number of cases. But it's also important that I highlight the reason why we have this outbreak. This outbreak is not happening in a vacuum. What has happened is that historically, a significant proportion of children that were born every year and surviving up to this time did not receive their diphtheria-containing vaccine. So, for example, if you say 1,000 children were born in 2018, less than 10% of them, for purposes of illustration, received the diphtheria-containing vaccine. So what happens is, for every year you have poor vaccination coverage in a bat cohort, you contribute people that are susceptible to the disease that the vaccines are going to be meant to protect against. And when that number cumulates to a large pool and the conditions are right for the introduction of the pathogen of interest, then you have an outbreak like we're seeing. So the situation is that we have got significant immunity gaps among people that are aged 5 to 14 years. And that is reflected in the age distribution of the cases that we're seeing now. These are people who missed on the opportunity of being vaccinated anything from 5 to 14 years ago. So right. A 5-year-old today was born in 2018. A 14-year-old today was born in 2009. So we are referring to historical gaps, not gaps that have come up in recent times. And as you know, because there have been more recent efforts to increase vaccination coverage, we think that these efforts have achieved the desired outcome, because fewer children less than 5 are actually affected by this outbreak.
Indeed.
Back to you.
And, you know, they say figures or numbers don't lie, but this is more than just numbers. These are the lives of people. If we're coming from 2011, when we had 98 cases, 21 deaths, to now when we've had over 500 deaths, even more devastating to hear that children, you know, are mostly affected. So can you maybe tell us, what's the government's response like? And I hope that we can try to benchmark this against COVID-19, for example. We seem to have built a lot of capacity during COVID-19. But the sense out there, and I've seen a lot of reports, is that Nigeria may just be struggling this time around with diphtheria.
I think it's important to not compare apples, with oranges. There are two different disease conditions, and unfortunately, yes, they both have devastating impacts on population. Diphtheria is it's a vaccine-preventable condition that we should not really be talking about if people were vaccinated. The vaccines were available. There may have been challenges historically for various reasons that you know just as well as I am, challenges with vaccine hesitancy. There were security challenges as well. And then COVID struck and sabotaged or put off all of the efforts that were, or arrangements that were planned to catch up with children and others who are poorly vaccinated, and the campaigns that were necessary. So this, basically tipped us over the top to a point where the susceptible population accumulated, and therefore we have this outbreak. We need vaccination, but unfortunately, vaccination now does not immediately address or put away a problem that has happened, or a situation that has accumulated over time. But we have responded, supporting states with provision of diagnostics,
right.
Also leveraging on some of the investments that were made during the COVID pandemic, although diphtheria is a different condition, and because it's re-emerging, there's very little experience with diagnosis of diphtheria. So we've had to set up laboratories, help set up laboratories to diagnose diphtheria. And at the moment, we started off as a preparedness effort with 6 laboratories, which we have now grown to 19, most of which are in the most affected areas for diagnosis. Diphtheria can be treated with a simple antibiotic, which is erythromycin. Oral erythromycin is relatively cheap and available. The challenge is when people are ill and then require what we call injectable forms,
right?
Because they can't swallow or not, then you need injectable erythromycin, which ordinarily is not available in the country. But again, the government, working with partners and using its own resources as well, has then purchased or procured doses of injectable erythromycin, which we continue to preposition and provide to our partners in states for treatment.
Well,
final bit is that we need diphtheria antitoxin, and of course, government working with partners with its resources and other resources mobilized has also been able to procure diphtheria antitoxin for specific treatment of diphtheria. Unfortunately, the global capacity for manufacturing diphtheria antitoxin is quite limited. And we are now having to struggle to lay our hands on enough doses.
Clearly, that's a huge work on our hands.
Yes.
Dr. Adetifa, and I wonder where we're at on the way to WHO's 80% vaccine coverage. But let's wind down on this one, because I know everything primary is quite vital in curbing further spread of this outbreak, and I'm talking the primary healthcare centers, even primary caregivers. So by way of maybe giving people tools which they can use from the northern part of the country to other areas that might be affected, what would you want primary caregivers to know, particularly in preventing and managing this disease?
Well, it's important that primary caregivers encourage members or people in their community and the clients that they serve to make use of every opportunity that has been provided to vaccinate infants, okay, to prevent the future cases. The Nigerian immunization schedule provides for immunization with a diphtheria-containing vaccine at 6, 10, and 14 weeks of life. But in the context of the outbreak, it's also important that we convince members of the community that we serve to come out and benefit from the vaccines that are being delivered by campaign. The second bit is the outcomes in diphtheria are related to early diagnosis and early institution of treatment. So when it's important that we educate the communities we serve, and of course our primary healthcare workers should have a high index of suspicion that when they see people with fever, with a cough, with swollen glands in their neck and under their jaw, and they have a membrane or a patch at the back of their throats,
right.
They should immediately seek to make diagnosis and refer to appropriate treatment centers for treatment to be started early. And then on the final point is primary healthcare workers have a role to share the right information about this disease and to also help the fight against the wrong information that is also going around and affecting people's health-seeking behavior.
And that's a very vital point. But I'd like to thank you so much, Dr. Fedayo Adetifa, the Director General of Nigeria Center for Disease Control and Prevention. Thank you for your time on the News at 10.
Thank you for having me, and thank you for all you do.